And more recently, we've been looking at genomics in elderly diffuse large B-cell lymphoma patients. So with all the newer treatments that are coming out, we are certainly able to treat older patients that we would not have been able to treat previously. So it's important to know what their genomics is, what might be the best way to treat them, what is the best prognostic marker for them. So my name is Dipti Talaulikar. I'm a clinical and laboratory haematologist at the Canberra Health Services. I've been working here for more than 20 years. And I'm also a professor at the Australian National University. I kind of followed a professor of mine. I really enjoyed his talk, Dr. Maman Chandy. This was back in India. I trained in India initially. And I was really impressed with his talk, so I followed him to Christian Medical College after my MD and did a DM there. Actually, I'm the first qualified woman hematologist in all of India, 1.4 billion population. Unfortunately, after that, because I had a young family, I couldn't find a part-time job. I wanted a bit more work-life balance for a few years. So looking for that, I moved to Australia and I've been working here since. I guess coming here, going through the fellowships and having that balance between my training in India and the opportunity to sort of think deeper, connect dots, focus on people a bit more has been really amazing. In terms of additional career points, quite early on in Australia, I was lucky enough to find really good mentors who encouraged me to take up academic medicine. So alongside my clinical work, that's always been a journey that I've taken both in research, education, and also to some extent in community work. More recently, I guess in the last 5 years, I developed a very keen interest in genomics. So training in genomics and obtaining that certification has been quite important. And of course, one of the key achievements for me was achieving full academic title of professor at Australian National University a few years ago. So that's still one of my career highlights. Right from when I did my PhD, I have had a very strong clinical and research interest in lymphoma, myeloma, and now in genomics. I've not done too much of basic research. I have collaborated with basic researchers, but my main focus, being close to the patient as a clinician, has been on translational research and something that can be translated into clinical practice a lot more quickly. So it might be finding a new prognostic marker. I came up with a new way to define prognostic indices in diffuse large B-cell lymphoma during my PhD. I've been a very strong proponent of writing clinical practice guidelines. So I've written several national and international guidelines across the space. It might be finding new ways of determining the pathogenesis of a particular disease. I'm particularly interested in a rare lymphoma called Waldenstrom macroglobulinemia. So I've published quite widely in that area in particular. And more recently, we've been looking at genomics in elderly diffuse large B-cell lymphoma patients. So with all the newer treatments that are coming out, we are certainly able to treat older patients that we would not have been able to treat previously. So it's important to know what their genomics is, what might be the best way to treat them, what is the best prognostic marker for them. The other area of research that I can talk about is something that came about from a patient bequest. I received a bequest from a patient who passed away with myeloma. And we've been doing drug repurposing studies. So basically drugs that are already out there and being used for other indications. We've screened about 350 of them to try and find drugs that might be effective in patients with lymphoma and myeloma. So we've just completed that project, and we still have to write it up for publication. But we've come up with some really interesting data. As you will find with with a number of clinicians, my funding has come from different sources. I mentioned the bequest that I had received from a patient. We also do a lot of collaborative research. So the project on elderly diffuse large B-cell lymphoma, for example, was funded through the ALLG, which is the Australasian Leukemia and Lymphoma Group. And the Canberra Hospital has both minor and major grants that we can tap into as well. So it's the category 2 and 3 grants that have been my main source of funding. And I should say quite a few projects don't really require any funding at all. So one of the publications I've had this year is looking at data from the Lymphoma and Related Diseases Registry, LADA, and that didn't require any funding at all. It was done in-house by myself, a medical student who's now a JMO a junior medical officer in Melbourne, and an advanced trainee or registrar in hematology who is now at a young consultant level. Yeah, our main collaborations are with the Australian National University, where I work and where my academic career has progressed. So I tend to collaborate with a number of researchers at the John Curtin School of Medical Research, and sometimes population health, and more broadly in the college as well. In terms of national organizations, I'm on the steering committee of the Lymphoma and Related Diseases Registry. So I've had some collaborations with them, and through the Australasian Leukemia and Lymphoma Group, as well as the Australasian Lymphoma Alliance, or the ALA. So through them, we've done national and international projects. I'm also part of an international group called the GLOW Study Project. That's based in the UK, and we're also working with a collaborator in the United Kingdom for a project on CNS lymphoma, or central nervous system lymphoma. I think medicine is observation-based. When we practice medicine, we use evidence that's there in the literature to drive our clinical practice. And I've always had a very firm belief right from the get-go that when we observe something different, either in the clinic or in a research setting, it is important to publish that. And I don't think any research is too small. It might be an important case study that someone else will really build on, that might end up creating a new classification system. It might end up creating a new prognostic marker. So that's been one of my driving forces, creating evidence instead of just using evidence from the literature. And I guess there's been a deeper motivation and driver for me. I was born in India, and in India you're acutely aware of your unearned privilege. So I am where I am because I was fortunate enough to be born to a family that was able to educate me, give me opportunities along the way, and someone else might not have had the same opportunity. So having that desire to give something back is very important to me. That's a very strong driver. I guess initial years were focused very much on career and family, but I've managed to resurrect some of my childhood loves. I like being active, so I've run a few half marathons. I enjoy hiking, I love some of the water sports, so kayaking and paddleboarding are something I try and do as often as I can. And I love cooking, so that's my go-to place if I need some downtime. This year I've also taken up painting and I'm really enjoying that.